reaction kind of approaches rather than trying to edit your thoughts and change emotion more head on. You're sort of letting your emotions be what they are, because the acceptance and commitment therapy sort of stuff.
Is mindfulness based in more like spiritual?
For some people, it clearly has a spiritual dimension. Some people are trying to kind of decontextualize the spiritual part, I guess, and import it more into cognitive behavioral realms.
It sounds like it's coming out of drug rehab therapy kind of thing. It's like it's all good. That came out of drug rehab. Most people don't know that, but that's where it came from heroin addicts. So now you all stop using it.
Well, a lot of good stuff comes out of the drug treatment. We need more drug treatment stuff with older adults. It's one of the big lacks. On that second bullet point about depression, reminiscence therapy would be a really good example of something where there's a lot of null results, and maybe even some negative results, but there are some positive results as well.
And that's just reminiscing, what it says.
Well,
Or is it
it can be both reminiscence. It tends to be used to include both reminiscence and life review in these reviews. I'd like to see people make more of a distinction, because I think life review therapy is much more structured. It makes a lot more sense. So we'll get into this, and if you're interested in this in more detail in the counseling class, we talk in some more depth about the history of reminiscence and different approaches to it. A brief psychodynamic therapy. So that's anxiety has just started being paid attention to as a problem. What you probably learned last week is it actually seems to be more prevalent than depression in older adults. For some reason, all of us, myself included, back in the early days of this work, all thought that older adults were mostly depressed, and the anxiety thing kind of came as a surprise at us in epidemiological studies, and it's kind of gotten more focused in treatment. Relaxation training has a lot of support, especially for anxiety symptoms and the subclinical levels of anxiety. Cognitive behavior therapy seems to work pretty well. As you might expect, the cognitive behavioral, as you can see in the readings for today, includes both changing how you think about your feelings as well as changing what you do. Yeah, Grace?
I was just curious, in your experience, I was wondering what works best with older adults, like if medication works better in terms of depression, or if therapy, or like a mixture of both?
I think for depression, I think either tends to work pretty well. One of the problems with really serious depression, the clinical standard is to do both, although I think there's not actually all that much research support that says that both is better than one, and there's actually some studies trying to look at it more carefully that suggest that adding medicine as cognitive behavior therapy doesn't add to the treatment effect. This is something else about that. One thing that you run into a lot with medication with older adults too is side effects. And so issues with using a lot of the medications, a lot of the antidepressant medications actually have anticholinergic side effects, which increase problems with attention, confusion, working memory, and things like that. Some of the antidepressant medications make people groggy for a while. So I think in addition to the lower relapse rates, I think another whole issue with psychological interventions versus medication is avoiding some of the side effects.
All these approaches, obviously are so individualized or individual based, including the medication and all. Is there? It seems like there should be an approach that's more like societal level, because it seems like that anxiety and depression are like increasing, and that might have to do with our lifestyles these days, or just something on like a broader scale.
Anything come to mind?
Like too many rats in a cage?
Yeah, well,
That's
just that like families are, getting smaller in general, or just, I don't know.
Make a TV show of like cute furry animals. Like people just tune in when they need a smile.
You could watch Sesame Street.
That's American
Yeah, you can watch
videos.
Sesame Street.
That's America's favorite videos.
I guess there's, like group therapy, and is that used at all?
There hasn't been a lot of evaluations of groups. Group therapies are used in quite a few places, so you can get a few more people at a time. My experience working in Southern California has been that I've almost never been able to start a therapy group for older adults that didn't involve people that had already got individual therapy. Now, I've talked to people in other parts of the country that don't have that problem at all, and I don't know if this is like some Southern California regional thing. Seriously, because I think I talked to people like in Michigan, where they run therapy groups for depressed older adults. They get people off the street that sign up for the groups. They have no problems getting people to participate from day one and so forth. And just I've had zero luck in 2 or 3 different locales. And most of the people I've talked with have done this kind of work in California for the same
Well,
experience.
I was just thinking, maybe it's more of a Midwestern inclination to get together, have coffee, and whereas we live in Southern California, it's such an individualized focus.
Well, I mean, some people, explicitly argue that, everybody who, aside from people who are born and raised here, of course, I suppose, that all the migrants into California, you have a lot of people who, if they had good social ties in the first place, would have stayed where they were. That old story about the way to understand Southern California, somebody picked up the United States by the state of Maine and tilted it up and everything that wasn't bolted down.
That's fun.
Here we go.
Right on time. Now it has 2 installations.
Are you talking supportive groups for just in general, as a sort of alternative to individual, or like supportive groups for people who are dying?
On this line,
Or
or
just,
just in we're talking about therapy groups. I'm not talking about support groups. I'm talking about active intervention. With anxiety, one of the things to keep in mind about psychological interventions and anxiety for older adults is it's becoming pretty clear in the young adult literature that unlike depression, it does seem to matter what you do, and there may actually be different psychological interventions for different anxiety disorder diagnoses. So like different phobias, obsessive compulsive disorder, generalized anxiety disorder, they all actually need somewhat different interventions for them. We don't know this with older adults. Nobody's looked at it this fine-tuned way yet. But I would warn against assuming that just because everything that you can do works with depression, that it's going to mean that everything that you can do works with anxiety. Anxiety tends to be more difficult. Somebody just posted about this. Maybe I said this on Blackboard, but one of the experiences I've had a number of times over the years is that people often seem to perceive that anxiety is a milder disorder somehow than depression. And my experience in general has been that it's more, yes, that's the right response. It's more functionally impairing, that people have a harder time coming in to get treatment. People have a harder time responding to treatment for anxiety. They're usually in worse shape when they're anxious, in more pain and so forth. I don't know why we think that.
So I missed a little bit of, so you were saying that different anxieties need different interventions
With younger
with younger people, but that hasn't been tested with older
It
adults.
hasn't been
Okay,
tested,
just
so we just don't know one by the other. Michelle Krask over at UCLA, who's one of the leading researchers on cognitive behavioral interventions with younger adults, also argues that this is an area, anxiety is an area where taking medication at the same time probably interferes with the cognitive behavior therapy, because most of the theories now of underlying psychological interventions for anxiety with younger adults involve needing exposure and desensitization to the physiological signs of anxiety. Because it's actually seen as being sort of a 2-component process, that it's not only that you're anxious and you're hyper-aroused physiologically,